This book I felt was really good. You go to the library, see which book suits your taste. And a nice thing about this book is it also talks about common inaccuracies and pitfalls. It's a beautiful book. Don't get intimidated by the size, which I probably think is the best option that you can go for, is because it is too vast, one, and you will not be able to cover the other subjects which you'll have to study. Book that I absolutely feel is a brilliant savior for both obstetrics and gynecology is, I do think you should close your eyes and buy this book. Everyone benefits. You can use it for your theory exams also, and this will help you in your NEET prep. This changed my perspective towards obstetrics and gynecology. You can use that book for even your theory concepts and revising your theory quickly. The thing that I love about this book is, one, the case studies are extensively discussed, and the other thing, they have a special chapter on ethics with regards to surgeries. It's like a totally complete book for your practical stuff. This is a very heavy book, 56th edition, and you can't really pick this up, but editions after this, they have divided it into 2 volumes so that they are easy to pick. Namaste everyone, welcome back to the channel. I hope all of you are doing great. Today we are going to discuss about final year med school books. So final year is very extensive. There is too much to cover. There are too many subjects. So without any further ado, let's get started. So we'll start with medicine. So medicine is a vast subject. So the 2 books that you have is Kumar and Clark's, alright, and there's another book called Davidson. Alright, so what you do, both these books are equally good. Kumar and Clark is a little bigger than Davidson, whereas Davidson is more concise. I personally used Davidson and I thought that it was a wonderful book. You have these treatment flow charts, a lot of tables with important signs and symptoms. Then you have a lot of beautiful pictures. You have these flow diagrams with all the symptoms and signs. So I think over and all, this book I felt was really good. You go to the library, alright, study one topic from each of the book, see which book suits your taste, and then decide on buying one of the books. Because you know, medicine, you're already in the final year of med school, so there is a way of reading text that you're accustomed to. So whichever suits your taste, buy that. Okay, invest in that book. The other book for medicine, which is the gold standard for medicine, is Harrison's. Okay, it is a very huge book. It comes in 2 volumes, but I would only like to say that I wouldn't recommend buying it in the UG level because it is too vast, one, and you will not be able to cover the other subjects which you'll have to study. But it's a beautiful book. Don't get intimidated by the size. If you get time, please refer a few topics from it. Though it seems like a big and intimidating book, the language is very easy and you will be able to understand everything. It is very expensive, so I won't recommend buying it, but you should definitely go to the library and read Harrison's. It's a beautiful book. Just for examinations, alright, if you have to use any book, then you can go for Matthews. It is a notes book. It comes in question answer format, pretty much covers everything. But please don't use it as a textbook. Only use it for quick revisions before the exams. Coming back to psychiatry and dermatology. Alright, so psychiatry and dermatology are included in medicine, in final year of medicine. So what you can do is these books like Kumar and Clark and Davidson will cover dermat and psychiatry sparingly. And even Matthews will have the topics of psychiatry and dermatology. If you are super keen, you can go to the library. And for I guess psychiatry, there's a book by Indian Psychiatry Society. So that textbook you can use only for the topics relevant to your curriculum. And for dermatology, you can use this book by Uday Khopkar. Again, only for the topics relevant to your curriculum. Coming to practicals, I think you have Kundu for cases. And this is a book only for cases. And then you have PJ Mehta for x-rays and instrument and everything. I have discussed the other good books to actually understand clinics better in medicine in the video where I discuss second year books in the clinical part. So what I'll do is I'll add the link in the description below and I'll add the timestamp also. I will just mention the books here in detail. I have discussed it in that video. Make sure that you check that out. So the books that I would recommend is these, see, PJ Mehta and Kundu are basic books, all right, so that you use just before the exams and everything. But if you really want to study and love medicine, then you can use books like Tally O'Connor. Now Tally O'Connor is a beautiful book on clinical examination. So what you can do is buy this in second year of medicine, start using it, and by final year of medicine you will be like sorted for life. So You have like every system is explained so much in detail, physical examination, x-rays, investigations, everything is there in this book. The other comprehensive books, Ashish Kumar Shah, then you have Sapira's Art and Science of Bedside Medicine, this also you can use, and then of course there is Hutchison's Clinical Methods that you can use. But I would definitely recommend that you go through this book by Tally O'Connor, a really good book. That's it for medicine. Let's move on to pediatrics. Now there is quite some overlapping between topics of medicine and pediatrics. For pediatrics, we generally use Ghai's Essential Pediatrics. It's a good book. It's a really good book. A lot of pictures and diagrams and everything is present. Boxes are present. But the problem with this book is that information is presented in blocks of contents, and it is sometimes the language is very difficult to understand. So although it's a good book, it's too time consuming. For final year, I feel the books that come to rescue are this textbook of pediatrics by Mukesh Agarwal, and there's a textbook of pediatrics by Piyush Gupta as well. Both these books have a very modular approach towards pediatrics. Information is presented in easy boxes, then it is point wise, so you can easily write answers for exam and it will save you so much of your time. So I would definitely recommend Mukesh Agarwal as well as Piyush Gupta for pediatrics. Definitely make your life so much easier and you will be able to understand better. Now, the other book, only and only if you are like very keen as of pediatrics as a specialty, or you are very interested in the subject, you can also go for a book by the Indian Academy of Pediatrics, textbook of pediatrics. Now, it comes in 2 volumes. Now, the thing is that you can use it according to your will. There are a lot of extra topics in these books, so if you're interested you can read those topics, and if you're just interested in the final year curriculum, you can only read the topics which are essential for the curriculum. It will really help you to understand the concepts and make them clear. Also, you can use this book as a reference for all the standard guidelines and protocols. When we come to practicals, Chheda is a book that you can easily avoid. All right, it will not help you much in practicals. What you can rather refer is Pediatrics Clinical Methods by Meherban Singh. Now again, this is a really good book. A lot of diagrams, a lot of real pictures, a lot of boxes which are present. So, and this book tells you about history taking and examination, very specific to children, and it logically explains everything. All right, the only thing is the language might be a little difficult and some people might find it difficult to interpret. The other option that you have, which I probably think is the best option that you can go for, is Piyush Gupta's Clinical Methods for Pediatrics. Now, this is an excellent and a brilliant book. What it does is it covers everything from history taking to physical examination to investigations and x-rays. So it also tells you in detail about every step, right? So like for example, how to frame a chief complaint. In the end, it also talks about certain procedures, practical procedures, and how to do them. So that will also help you in internship. The language is very simple. The approach is very modular. So that will help you. Then the other nice thing about this book is it also talks about common inaccuracies and pitfalls that you do during a clinical practice, and it also talks about the correct approach of doing the same. So that really helps. Additional benefits, you have these key boxes with signs and symptoms, and there are also historical pearls so that the history gets its regarded due. And this is a complete book for pediatrics practicals. You can definitely refer to this by Piyush Gupta. Yes, I think that's all for practicals and theory of pediatrics. Let's move on to obstetrics and gynecology. Now, there comes Datta's book for obstetrics as well as gynecology. Both the books are there by Datta. Many people use this book, but what I personally feel is that there is too much information which is given, and also the information I feel is not a little difficult to understand, too confusing, but many people find it as per their taste, and they definitely use and really benefit from Datta. So this is one option that I could definitely can recommend for people. But one book that I absolutely feel is a brilliant savior for both obstetrics and gynecology is the book by Sakshi Arora. Now, this is the obstetrics version. There is the same for gynecology. Now, this is an absolute delight of a book. The more I talk about this book, the less it is. It will definitely sort out your obstetrics and gynecology both. It will save you a lot of time. It comes as an absolute savior. I do think you should close your eyes and buy this book. Everything is concise to the point with explanations wherever necessary. There are a lot of boxes, a lot of key points that you will remember. So it has twin benefits. You can use it for your theory exams also, and this will help you in your NEET prep, because actually it's a prep manual. So it is adequately illustrated. There are questions, MCQs. So this books both for Sakshi Arora, both for obstetrics and gynecology, totally sorts you out. Now, if you're looking for other options, then I think as a reference book you can go for Shaw's textbook for gynecology. The only issue with this book is there is too much information and it is presented as blocks of content, so you definitely cannot write answers from it. But of course you can use Shaw's for reference and for clarifying your concepts. But one book that I would definitely recommend is Holland and Bruce Manual of Obstetrics. Now this is an excellent book. The information is freely flowing, all right, so you will never feel like you're reading something difficult or anything. It's very simple. The other thing about this book is you have like management of everything is given in flowchart form, so that really helps. After the end of each chapter there are points to remember. I got this book as like a prize for some quiz, and I think this changed my perspective towards obstetrics and gynecology. So everything is short and concise. The author has made it point wise, so you can really benefit from this book. You can write answers from this book. Like there are tables and there are flow charts which are very easy to reproduce in the exam and help you to remember a lot of things. Definitely Holland and Brew is one book that you can buy and keep. Coming back to the practicals, now Virkud is one book that everyone uses. Now again for UG level, I think it is brief and you can use it for your practicals, but it does not have like, it just has a typical case format, but it does not discuss all the other cases like anemia, hypertension, diabetes and everything. So that is not discussed in detail. It's like a short and sweet book if you want. The other options that you can go for is the books by Sharmila Arun Babu, and there's also Datta's Bedside Clinical. Now Datta's Bedside Clinical is black and white, but it covers all the practical questions for each case. So each case is discussed like that. With Sharmila Arun Babu is again a more comprehensive book, and you can use that book for even your theory concepts and revising your theory quickly, because it includes everything and all the cases are discussed in detail. Like cases for anemia will be discussed and the case discussions will happen. So like that, it's a more extensive book. So you can have Datta's Bedside Clinics or you could use Sharmila Arun Babu's book. That's about it for obstetrics. So for surgery, the two books that you have is one is SRB's Manual for Surgery, and the other book that you have is Manipal's Surgery. Right now they have made it into 2 volumes. It is based on the new CBME curriculum. These two books, both the books will have anesthesia, and it will also have the table vivas like X-rays, surgical pathology specimens and operative procedures, instruments. All of them are included in both the books. So with SRB's Manual for Surgery, I think it is richly illustrated. The good thing about this book is everything is like in notes form, so it's very easy that you can easily write answers from this book. Whereas that is the only drawback as well, because everything is to the point. There's nobody explaining anything to you, so it might make surgery feel a little bland. With Manipal, it's a very nicely looking book. The concepts are also explained wherever necessary, and with the explanation, they have not broken down the modular pattern. So everything is stepwise only, but with explanations wherever required. Then there are also MCQs, so that will also help you. Then there are a lot of flow charts, boxes which would help you in remembering things, and also for major diseases they have these whole concept maps with investigations, treatment and follow-up, and all the management is given in one page. The one thing that I love about this book is one, the case studies are extensively discussed, and the other thing, they have a special chapter on based on AIDCOM, like attitude, ethics and communication. There are chapters on doctor-patient relationship, then communication and counseling, the ethics with regards to surgery. So all in all, it is definitely a very good book. It's a very heavy book. This is Bailey and Love's a short practice of surgery. I think Bailey and Love for Surgery is the gold standard. Definitely wouldn't recommend buying it in your UG years, but please go to the library. This is the 26th edition and you can't really pick this up, but editions after this, they have divided it into 2 volumes so that they are easy to pick and read. The one thing about this book is everything is explained in detail. your concepts will be clarified. You will develop the in-depth understanding about surgery as a subject. So the only drawback is it is not based on the Indian setup, all right? So there you might have some issues, but all in all, it's definitely worth a read. So I won't say that read this entire book, but for certain topics, just definitely go to the library and read at least certain topics from this book. You will really enjoy surgery even more. And also, if you have certain doubts in certain topics and you want to clarify that, please refer to this book. Language is very easy to understand and it has a narrative flow, so you will not find it difficult to understand at all, although it looks like a very big book. Coming to the practicals. Okay, so practicals, people use SDAS. The thing with SDAS is it covers everything: history taking, physical examination, investigations. Also, the differential diagnosis are explained extensively and in detail. Other books that you can use for your practicals are now there is again Hamilton and Bailey's Demonstration of Physical Science and Surgery. Now again, this is a really good book, but it becomes too extensive and too comprehensive for final year. But again, for certain things which you are having doubts and you want to clarify, then you can go to the library. And this is a old edition, but you will have newer editions of the book, so you can, for clarifying those concepts, you can use this book. But if you want a prep manual for yourself, you could either go for Manipal's Manual of Clinical Surgery, or you could go for Makhan Lal Shah. Now both these books are equally good. Now Makhan Lal Shah, it starts from, it's like a total complete book for your practical. Starts from surgical anatomy, then goes to history taking, then physical examination, investigations, management. So it covers everything. The other good thing about this book is that it has a case-based question and answer format, Viva format. So it will really help you in your actual Vivas during exams after the cases. So that is one thing which is very good about this book. Definitely a really good book that you can really think of buying and using in final year. So that is Makhan Lal Shah. The other book is Manipal Surgery. Again, richly illustrated case discussions are there in question answer format. Then you have everything is covered, case wise, x-rays, instruments, everything is done. Some people may find it to be lesser comprehensive, but I think it covers everything that is required in the UG level sufficiently. So you could go for either Manipal or you could go for Makhan Lal Shah as a practical book. Other small book that you should have is RDB's Art of Clinical Presentation in Surgery. Now this is a really cute book. It is a small red handbook that you have. You can get it from your seniors because they will definitely have it. This book has all the case formats with, you know, concise explanations and everything. So you can't use this as the only resource, but it definitely becomes very, very important during your before your exams, where you can actually revise the entire surgery, all the cases, with the help of this book. So you can add your own notes to this book and this really becomes your guide. So this book is definitely one thing that I would recommend along with the other practical books that I have suggested. So I think that's all for surgery. Let's move on to ortho. Now ortho also becomes like a part of surgery. One book called Manishwari. Now this book is sort of detailed information is not given in this book. It is more like concise information that is given in this book. There are also tables for management. And the other book that is definitely more student friendly is Natarajan. A very well structured book. It also helps you to develop an understanding about ortho. The other salient features about this book is that you have self-assessment questions from the past 10 years of modular approach. It will definitely help you in ortho. In case you need a practical book for ortho, you can go for Kaushik Bag. Equipment that you will need for, I think, medicine, you would probably need a stethoscope and a hammer. For surgery, you might need gloves and you will need a torch for trans-elimination of swellings and all. For obstetrics and as well as pediatrics, you will need measuring tapes for measuring the abdominal girth and the head circumference of children and all of that. So that for that you will need measuring tapes, and I think that's it about the equipment that you will need in final year. Well, I think we have reached the end of this video. So if you like this video, please make sure that you give it a thumbs up and leave your comments and suggestions below. I'll probably read them and it will help others who are looking for books. The other thing is, if you haven't subscribed to the channel, please make sure that you click the subscribe button and tap the bell icon so that you do not miss any other video from us. You can also follow me on Instagram. My handle is Priyanka_Dana at 24. Thank you so much for tuning in. I will see you next time very, very soon. Till then, take very, very good care of yourself. Love and peace.
scared of it.